Hi, everybody. Hope you're doing well today. So, in our previous videos, we've been looking at consequentialism and utilitarianism, considering some of their advantages and disadvantages. Well, in this video, we're going to consider some comparative cases to help us reflect on not just utilitarianism, but other ethical theories as well. But those comparative cases is also going to raise a puzzle that we're going to have to consider, well, how best to solve that puzzle? What kind of ethical theory could help us solve that puzzle? So, we'll briefly review consequentialism and utilitarianism. We'll talk about some of the problematic cases. What I mean by problematic cases here is when we compare these cases, there's a problem because it's not clear how we can consistently think through the morality of these cases together. Then we'll use that to introduce what's called the trolley problem. So, consequentialism is a moral theory that says an action is morally required just because it produces the best overall results. One influential and simple version of that theory was act utilitarianism, which says an action is morally required if and only if it does more to improve overall well-being than any other action you could have done in the circumstances. So this is a kind of consequentialism where it says what you're trying to maximize with your actions is overall well-being. And again, not just of yourself, but of everyone involved. So we've taken a look at a doctor and needy case. Let's remember the details. There's 6 patients that arrive at the ER at the same time. They've all been poisoned. 5 of the patients need 1 dose of medicine to survive. The 6th patient, needy, however, is sicker than the rest and must receive 5 doses of the medicine to survive. But the hospital only has 5 doses of the medicine. Is it okay for the doctor to give 1 dose to each of the 5 and thereby save the 5 patients, which would then lead to needy dying as a result? Most people tend to think, yes, that is okay. In fact, that's what the doctor should do. They're stuck between a rock and a hard place where no matter what they do, someone's going to die, and 1 person dying is better than 5 people dying. So consequentialism seems rather plausible when applied to this case. But consider another one. I'm not going to give you the title yet since I might give it away, but here 5 patients arrive at the ER at the same time. They each are about to die of organ failure, but they each need a different organ to survive. Maybe one needs a lung, one needs a heart, one needs a kidney, etc. But there's not enough time to get organ donations. But thankfully, there are some healthy organs available to the doctor. There's a healthy person in the hallway that the doctor knows is a universal match. So let's imagine that this doctor knows for certain that if they were to take this healthy person's organs and put them in the 5 patients would survive. Obviously, that healthy person would die as a result of losing those organs. Is it morally permissible for the doctor to harvest the healthy person's organs and save the 5? Now, most people see this and they say, of course not, that's morally atrocious. Especially, imagine yet again, the doctor does not have this person's consent. And now, you might be thinking, look, the doctor would likely go to jail and get caught. Let's ignore it. Let's imagine that nobody would ever find out. The doctor would never go to jail. Nobody would know what would happen. The only results are either 5 people live or 5 people die. So 5 people live, 1 person dies, or 5 people die and 1 person lives. All right, this is called the organ harvesting case. Now, a number of cases known as trolley cases have also become very important in reflecting on these ethical theories. They're probably discussed more often than they should, but they are important to consider. We've already saw 2 of these. The first is the driver trolley case. You're the driver of a train headed towards and about to kill 5 people. You can divert the train to some tracks to the left, but there's 1 person on those tracks who you'll hit and kill if you do. Is it okay to divert the train to save the 5? Now, most people think, well, look, yet again, you as the driver are stuck between a rock and a hard place where either you go forward and kill 5 or you go to the left and kill 1. And, 1 person dead is better than 5 people dead. Well, the bystander trolley case is the same kind of idea, but in this case, the train's driver had a heart attack and the train's headed towards the 5 to kill them. You are a bystander in this case, so outside of the train, but you notice that there's a switch that you could pull to divert the train to some tracks on the left. but there's one person on those tracks who you'll hit and kill? And is it okay to pull the switch to save the 5? Yet again, most people respond, well, yeah. In this case, someone's going to die, and it's better to have one person to die rather than 5. Yet again, we're assuming these are your only 2 options. All right, now consider you're on a bridge and see an empty runaway trolley headed towards 5 people it will kill. You can't warn the 5 persons to get out of the way. You look for a way to stop the trolley. You can't find anything until at last you see, oh wait, there is one way. There's a large person next to you on the bridge, and you know that if you throw them in front of the trolley, they will die as a result of the impact. But this sort of collision there'll be enough weight to stop the trolley before it hits the 5. Is it okay for you to throw the large person in front of the trolley? Most people think, of course not. That's not okay. When most people consider these cases, they tend to have the following reactions. They think it's morally permissible to save the 5 in the doctor and needy case, in the driver trolley case, and the bystander case. But most people tend to think that it's morally wrong to save the 5 in the organ harvesting case and in the large person case. Now, one of the questions here, though, is this really consistent? The consequences are exactly the same throughout them. So how could we explain the differences? How can we consistently sort of explain these beliefs? Well, notice this seems to pose a problem still for consequentialism and utilitarianism. As I said, in all the cases, the consequences are identical for the 2 options. Remember, I've stipulated these cases so that there are only 2 options. Option 1, 5 lives are saved and 1 person dies. In option 2, 1 life is saved and 5 persons die. Those are the only 2 options, and those are the consequences in every single scenario. If the consequences of the action are the only thing that's relevant to morality, then it seems as if option 1 should be the morally right action in all of these cases. It seems as if that would be the consistent answer throughout. But our different reactions to these cases suggest that we think there's more that's relevant to morality than just the consequences of our actions. So, the organ harvesting and large person trolley cases can also motivate that problem of injustice we talked about last time. In each of these cases, in order to save the 5, you'd have to do a severe injustice and violate the rights of one person. The healthy person in the organ harvesting case, or the large person in the trolley case. In each case, though, consequentialism seems as if it would require us to commit this severe injustice. And in each case, it seems as if it's morally wrong to commit that injustice, even though it would lead to better overall consequences. Thus, it seems as if consequentialism and utilitarianism are not the correct theory of morality. However, what's the moral difference between these cases? Can we actually make our different reactions consistent? Why is it okay to save the 5 at the expense of another person's life in the doctor and needy, driver, and bystander cases, but it's not okay to save the 5 at the expense of 1 in the organ harvesting and the large person cases? Now, to make this sort of seem even sort of more difficult maybe is keep in mind that in all of these cases, you need to make a choice. Choosing not to do something is still making a choice. So if you choose not to save the 5 in the organ harvesting case, you are still making the choice not to save them. In all of those cases, if you save the 5, then 1 person dies as a result of your choice. So if you save the 5 in the doctor and needy case, needy has died as a result of the choice you made. Had you not made that choice, needy would not have died. And in all the cases, if the 5 die, they die as a result of your choice. So in the organ harvesting case, if the 5 people die, it's because you chose not to harvest the organs of that person. All right, so given those similarities between all the scenarios, can we really consistently treat them differently? And if so, how? Now, one common strategy here appeals to the following idea. It's what's called the doctrine of doing and allowing. The idea here is, other things being equal, it's morally worse to do a harm than it is to allow that same harm to occur. So the idea here is, even if the consequences are exactly the same, there might be a moral difference in how you got those consequences. Did you get those consequences by doing something, or did you get those consequences by allowing something? So, for instance, imagine that I see another person about to hit Bob in the face. Now, I could stop them, but I choose not to. I allow them to hit Bob in the face. Now, that might seem bad. Maybe I should have stopped them, but wouldn't it be even worse, even more morally wrong of me, if I were the one punching Bob in the face? It's the same consequences, the same pain and suffering. But in one case, the pain and suffering is the result of my sort of allowing another person to hit Bob in the face. And in the other case, it's my doing the harm to Bob myself. And that seems to be worse. So how can this apply to these scenarios? Well, you might say, look, in the doctor and needy case, you have a choice between letting one die or letting 5 die. In both cases, you're allowing people to die. Well, we're comparing apples to apples there, and so obviously allowing 1 to die is better than allowing 5 to die. In the driver case, you have a choice between killing 1 or killing 5. But yet again, we're comparing apples to apples. In each case, you are doing the harm yourself. And so that would explain why, okay, well, maybe all that matters there is the consequences, since you get the consequences in the same way. But notice, in the organ harvesting case, you have to choose between either killing 1 or letting 5 die. So it's a choice between doing or allowing. And so someone might say, in that case, maybe the killing, the doing is just so bad that it's better to allow 5 to die than to do the killing yourself. Similarly, in the large person case, you have a choice between killing 1, the doing of the harm yourself, or letting 5 die in allowing. But there's a problem. What about the bystander case? In that bystander case, if you pull the switch, you are killing that one person. Or if you don't pull the switch, you would only be allowing those 5 to die. But nonetheless, it seems to most people, the reaction that they had was that it's okay to pull the switch. Maybe you don't have that intuition, but if you did, it seems as if you're in a bit of a pickle here. And again, in the large person case, you are faced with that same choice between doing the harm, killing the person by throwing them in front of the trolley, or letting 5 die. And so this is what the trolley problem is. It's the difficulty in identifying a moral difference that would explain why it's morally okay to save the 5 in the bystander trolley case, but not in the large person trolley case. So sometimes when people hear the trolley problem, they just hear one case and then someone says, what's the right thing to do? That's not the trolley problem. The trolley problem is when you compare these two cases that look to be pretty much the same, but our moral reaction is that it's okay to save the 5 in one, but not in the other. And trying to explain why that would be okay in the bystander case, but not okay in the large person trolley case, that's the trolley problem. Now, the consequentials might say, look, you just can't do this. There's no important moral difference here that you can sort of rationally appeal to. And so they might say, when upon reflection, since we can't justify this distinction, maybe we just should be consequentialists. Anyways, that's it for now. In the next video, we'll start looking at a competing theory of morality from Kant that might maybe do a little bit better here. See you then.